Welcome to today's video lecture on madeformedical.com. Today, we're going to delve into a fascinating topic, Lyme disease. Lyme disease, also known as Lyme borreliosis, is an infectious disease caused by the bacteria Borrelia burgdorferi. It is primarily transmitted to humans through the bite of infected black-legged ticks commonly found in wooded and grassy areas. The pathophysiology of Lyme disease involves a complex interaction between the infectious agent, Borrelia burgdorferi, and the human body's immune response. Transmission and initial infection. Lyme disease is primarily transmitted to humans through the bite of infected black-legged ticks. When an infected tick feeds on a human host, it transfers the spirochete bacterium Borrelia burgdorferi into the bloodstream. The bacteria then disseminate throughout the body, leading to infection. Localized inflammatory response. Following the initial infection, an inflammatory response is triggered at the site of the tick bite. This response is characterized by the infiltration of immune cells, such as macrophages, neutrophils, and dendritic cells. These immune cells recognize the presence of Borrelia burgdorferi and release inflammatory mediators, including cytokines and chemokines, to initiate an immune response. Dissemination. If left untreated, the bacteria can spread from the initial site of infection to other tissues and organs in the body. This dissemination occurs through the bloodstream and lymphatic system. Borrelia burgdorferi can invade various tissues, including the skin, joints, heart, nervous system, and other organs, leading to the wide range of clinical manifestations associated with Lyme disease. Immune response. The immune response plays a critical role in the pathophysiology of Lyme disease. Initially, the innate immune response is activated, involving various immune cells and inflammatory mediators. The adaptive immune response, particularly the cellular immune response involving T cells, is also activated. The immune system's primary goal is to clear the infection by targeting and eliminating Borrelia burgdorferi. Persistent infection and chronic inflammation. In some cases, the immune response may not fully eliminate the bacteria, leading to a persistent infection. This persistent infection can result in chronic inflammation. The mechanisms underlying the chronicity of the infection are not fully understood, but they may involve various factors, including the ability of Borrelia burgdorferi to evade immune detection and manipulate the host's immune response. Autoimmune reactions. In some individuals, the immune response to Borrelia burgdorferi may trigger autoimmune reactions. Molecular mimicry, where components of the bacterium resemble host tissues, may lead to the production of autoantibodies that mistakenly target self-antigens. This autoimmune response can contribute to the development of chronic symptoms and complications in Lyme disease. Lyme disease typically progresses through 3 stages, and symptoms can vary depending on the stage of infection. Early localized stage. Within 3 to 30 days of a tick bite, an early localized stage of Lyme disease may occur. The characteristic early symptom is a gradually expanding skin rash called erythema migrans. This rash often appears at the site of the tick bite and can expand over time, resembling a bull's eye pattern. Other early symptoms may include fatigue, fever, headache, muscle and joint aches, and swollen lymph nodes. Early disseminated stage. If left untreated, the infection can spread to other parts of the body, leading to the early disseminated stage. This stage typically occurs weeks to months after the initial tick bite. The bacteria can infect multiple organ systems, resulting in various symptoms. These may include additional rashes in different areas of the body, flu-like symptoms, e.g., fever, chills, fatigue, muscle and joint pain, headache, stiff neck, facial palsy, drooping or weakness of the facial muscles, heart palpitations, and dizziness. Late disseminated stage. If Lyme disease remains untreated for an extended period, it may progress to the late disseminated stage, which can occur months to years after the initial infection. This stage primarily affects the joints, nervous system, and occasionally other organs. Common symptoms include severe joint pain, particularly in the knees, swelling and inflammation of the joints, arthritis, neurological problems such as numbness, tingling, shooting pains, and short-term memory problems. In rare cases, late-stage Lyme disease can lead to heart problems or inflammation of the brain and spinal cord. The diagnosis of Lyme disease involves a comprehensive approach that combines clinical evaluation, medical history, and laboratory testing. Here are the common steps involved in diagnosing Lyme disease. Obtain a detailed medical history. Begin by taking a thorough medical history from the patient. Inquire about any recent tick bites or exposure to tick-infested areas, as well as the onset and progression of symptoms. It's important to note any characteristic symptoms associated with Lyme disease, such as the presence of an erythema migrans rash. Consider laboratory testing. Laboratory testing plays a supportive role in confirming the diagnosis of Lyme disease. Serologic testing is commonly used, starting with an enzyme immunoassay, IA, to detect antibodies against Borrelia burgdorferi. If the EIA is positive or equivocal, a confirmatory test, such as the Western blot, is conducted to identify specific antibodies against different components of the bacteria. It's important to interpret the results in the context of the patient's clinical presentation and consider the limitations of the tests, such as the potential for false negatives in early-stage infections. Serologic interpretation. The interpretation of serologic test results can be challenging, particularly in the early stages of infection. False negative results are possible if testing is performed too soon after infection, as it takes time for the body to develop detectable levels of antibodies. It is essential to consider the clinical presentation alongside the laboratory results for an accurate diagnosis. Additional testing. In certain cases, additional tests may be necessary to evaluate specific symptoms or complications. For example, if Lyme disease affects the nervous system, a lumbar puncture, spinal tap, may be performed to analyze cerebrospinal fluid for signs of infection or inflammation. Once diagnosed, the treatment of Lyme disease involves a multifaceted approach aimed at eliminating the infection, managing symptoms, and preventing complications. Antibiotic therapy. The primary treatment for Lyme disease is antibiotics. The choice of antibiotic and duration of treatment depend on the stage of the disease and the severity of symptoms. Commonly prescribed antibiotics for Lyme disease include doxycycline, amoxicillin, and ceftriaxone. These antibiotics are effective in eliminating the Borrelia burgdorferi bacteria. The duration of treatment typically ranges from 10 to 21 days, depending on the stage of the disease and the presence of complications. Early localized and early disseminated Lyme disease. In the early stages of Lyme disease, when the infection is localized or has disseminated, oral antibiotics are often prescribed. Doxycycline is usually the first-line antibiotic for adults and children over 8 years old. Amoxicillin or ceftriaxone may be used as alternatives, particularly in children and pregnant women. Late disseminated Lyme disease. Late-stage Lyme disease, which involves complications such as arthritis or neurological involvement, may require a longer course of intravenous antibiotic therapy. Antibiotics, such as ceftriaxone or penicillin G, are administered for 14 to 28 days, depending on the severity of symptoms. Symptom management. In addition to antibiotic therapy, symptomatic treatment may be necessary to manage specific symptoms. Pain relievers, such as nonsteroidal anti-inflammatory drugs, NSAIDs, can help alleviate joint and muscle pain. If joint inflammation persists, corticosteroids may be considered under the guidance of a specialist. In cases of neurological involvement, supportive measures such as pain management, physical therapy, and occupational therapy may be beneficial. And that concludes our discussion on Lyme disease. This tick-borne illness requires vigilance and awareness, particularly in regions where it is endemic. As doctors, it is crucial to stay informed and consider Lyme disease as a potential diagnosis when evaluating patients with compatible symptoms and exposures. And that brings us to the end of today's video. I hope you found the information helpful and informative. If you enjoyed this video, don't forget to give it a thumbs up, and don't forget to sign up for a premium membership on our website, madeformedical.com, for more content like this.